patient care. If anyone knows about this healthcare debate, it's doctors, and we need to start listening to them instead of listening to the guys we send up to Washington, D.C. by mistake. We need to listen to the actual doctors. So give it up, Dr. John Fanning.
Thanks, Dale. You know, one of the things I'm happy about today is that I don't have a full head of hair. It's kind of hot out here. I want to thank all of you for coming out today. I'm thrilled that we have such a great turnout. Every time we have one of these things, it gets bigger and bigger, and I'm excited about that. I also want to thank Chad Capps for putting this together, and all the people at the Huntsville Tea Party as well. They're doing a great job. Let's give them a hand. I also want to thank Christy Carden for all of her hard work in helping to form and solidify the Huntsville Tea Party. I know she did a lot, and she helped me to get involved with it as well, and we appreciate that as well. You know, last August, when we all learned about the health care bill, I, like you, was outraged. The arrogant elite of Washington were forging ahead with a horrible plan that would forever change how I take care of my patients and how I would be cared for as a patient. Most of you don't think about doctors as patients, but we're patients too. So I took my wife and my 13-year-old son to Washington, D.C. on September the 10th to a doctor's rally and to the 9/12 rally. None of us had ever been to a rally. Heck, I don't even raise my voice at a PTA meeting, much less go to a rally. The doctor's rally was sponsored by a group that that Dale mentioned called Docs for Patient Care, and I'll tell you a little bit more about that group a little bit later on. We had about 200 doctors, along with nurses, therapists, pharmacists, and other healthcare providers, and we visited with several congressmen, including our very own Parker Griffith. We discussed with them our anger and our concern. We felt so empowered being surrounded by hundreds of people who were just as angry as us. We met one lady named Marie who expressed exactly what we felt. When I asked her why she came to D.C., she said, "I'm mad as hell, and me and Harry are tired of screaming at the TV, so we came down here." Everyone else we met said similar things, not with that accent. They're regular Americans protesting against their government. On September 12, 2010, we experienced something that I will never forget. We were surrounded by thousands of Maries and Harrys, regular, normal, hard-working Americans eager to have their voices heard. Easily 1 million people flooded the Capitol. The crowd was so big that security closed a portion of the west lawn of the Capitol. One D.C. policewoman told me that the permit for the rally was for 50,000 people and that they could legally arrest anybody above that number. When I looked at her, she said, "How do you arrest 1 million people?" We had never seen anything like it. Flags, signs, banners. I even saw 2 young men wearing coats made of, now get this, coats made of AstroTurf. That was the funniest thing I saw the whole time I was up there. As I scanned over this mass of humanity, 1 million orderly, patriotic, sometimes boisterous people, in my heart, I knew what I was seeing. I was seeing the spirit of America. And that is what you are as well. You are the spirit of what America stands for. Faith, hope, charity, self-determination, self-reliance, freedom, and liberty. Give yourselves a hand. Feeling overwhelmed and amazed by the experience, we began to make our way back to the subway, and it occurred to us that there was no trash anywhere. The trash cans were full and overflowing, but there was no trash on the sidewalk, no trash in the street. The trash cans had trash lined up beside it very neatly, but there was nothing anywhere else. Ladies and gentlemen, these are the Tea Partiers. Occasionally raucous, occasionally inappropriate, occasionally rude. Kind of sounds like my family reunion. But mostly regular, proud, angry Americans like us. We were exhausted, but so proud to be part of an historic day. Needless to say, when we saw the poor press coverage of the event, we felt deflated. How could the guys on CNN say 75,000 when there was easily 1 million people there? I mean, we shut down the D.C. Metro subway system, for goodness sake. These days, when I watch the news, I hear something about the Tea Party nearly every day. And I realize that this group of ordinary Americans, who are all just like Marie and Harry, are for real, and they're here to stay. And you know what? We want our country back. Don't you want your country back? You know, the hard work and persistence of all these individuals is no different than the original Tea Parties who, 236 years, 3 months, and 30 days ago, made their stand against tyranny. We stand here today like Samuel Adams, in a different time, in a different place, but we fight the same foe, the tyranny of our government. Two centuries ago, our founders were being taxed against their will by a corrupt government, without proper representation and without a true voice. That sounds really familiar. Let me see. A 2,700-page bill, not read by any of our representatives. $2.5 trillion more spent to pay for it with money that we have to borrow. Bribes, backroom deals, lie after lie after lie. No support of the minority party. 63% of American people against it. Thousands marching on the Capitol steps for weeks before the vote. And now, it's the law of the land. That's wrong. That sounds like tyranny to me. That sounds like tyranny to you? So I'm often asked, John, what's really in this new health care law? I have studied and reviewed as much as I can, and I can tell you I've read a lot more than the people that voted for it. I've looked at what it contains, and I can confidently say this. It is a complete and total dismantling of the entire amazing American medical system as we know it. It mandates that every American must buy health insurance under IRS scrutiny. I like to call that a breath tax. That's right, a breath tax. If you breathe, you pay. It sets up an army of federal bureaucrats, including those who ultimately decide for you how much you should receive, how much health care you should receive, what kind, and whether or not you qualify at all. Never in America's history has our government claimed the power to decide when each of us has lived well enough or long enough to be refused life-saving medical assistance. It strips $1/2 trillion from Medicare, reducing payments to home health, to hospice, rehabilitation centers, ambulance services, and dialysis centers. It penalizes primary care physicians like myself. I'm a general internist. It penalizes us for sending patients to specialists or for ordering tests for seniors. Have you heard of the Independent Payment Advisory Board? It's called the IPAB. You're going to love this. First, it's appointed by the president and does not require congressional approval. Sounds like a board of czars to me. This board will decide all Medicare funding changes, and any recommendation made by this board becomes law unless it is reversed by Congress. This board basically becomes a branch of the legislative branch, and without a vote or without congressional oversight, and they're beholden only to the president. Now, last night I had a group of doctors I spoke with about these issues, and when I said to them, I'll